Let's see if it works. I'm not sure if it's working. Let me see. Sorry guys, we have an audio problem, but it's would you mind try talking so I can see if I can hear your voice?
Yes. Can you hear me? Hello?
Yeah.
Can you hear me?
All right. Sorry. Just wait a second.
Okay.
Would you mind try talking so I can see if I can hear your voice?
Yes. Can you hear me?
Yes. Okay. So we can hear your voice. Let's try this. All right. The live is ready and we're ready to go right now. Hello everyone, welcome back to another virtual dental shot-in session. Our guest tonight, Dr. Garcia, is an orthodontist from Venezuela who later came to the US for the International Trained Dentist Program. Thank you again, Dr. Garcia, for your time. I'm going to leave the mic to you, so feel free to take over whenever you're ready.
Thank you so much. You're very kind. Thank you for having me. I think what you're doing is really great, especially in this COVID time. I think it's great to have this virtual initiatives from people from all over that are interested in pursuing a dental career, and maybe they're not allowed into offices to shadow, to look around and see what's going on, what's it like to be a dentist. And that's something probably all of us that are already doing it, that's something that we did at some point. We went into an office, we got a grasp of what was like to be a dentist, what was the day like, if it was busy or not. And we probably even did it several times to see how busy different practices were. And yeah, I appreciate what you're doing. I think it's really good, and I hope it's helpful for your viewers. My name is Eduardo Garcia. Thank you so much for your kind introduction. I'm a student right now at the School of Dental Medicine at the University of Colorado. This is a 2-year program for international students. We're all dentists from our countries of origin, and we're a group of 40 candidates, and the regular dental students are 80. So overall, we're like 120 students on some of the courses. It's a pretty big number. So I think that's really positive for anyone that's wanting to apply, that those big numbers are being gathered, so you have a bigger chance of getting into the school. I'm at the second year, so I'll be graduating at the end of this year in December. Colorado has a different schedule from other universities here in the US. So applying here, it's at a different timing than other schools. You do apply for international students. We do apply for the CAPIT, which is an acronym. I don't remember right now exactly the words for each letter, but it's something like it's the place where you submit all the applications for all the schools that you want to apply. It's the way the American Academy of the American Dental Academy kind of puts together this web page for applicants to streamline their applications. So you do it from there. For Colorado, it's just a different schedule. And yeah, that's why we'll be graduating in December, which I think is great. I think it's a great time, and it can be cumbersome for some people. If you have a family here in the U.S., the academic year for your children are gonna be August to May of the following year. So if you have to move in December out of state or from abroad, it's kind of awkward in that sense. So yeah, I think that's one of the little issues that I have with this schedule. But overall, I think it's very, very good. Okay, this is my first time using the Google presentation, so that's good. Okay, so my background is from Venezuela. I'm Venezuelan, and that's where I graduated as a dentist in 2006 at this university here in the picture on the top. I don't know if you can see my cursor. That's the Universidad Santa Maria. And the one below it is the following, Universidad de Carabobo. That's where I did my specialty program in orthodontics. It's a 3 year program over there. It's very extensive. We see lots of patients. It's very thorough. This is the type of things that are very key in your career. Sometimes doing something that it's it takes a lot of effort, but the payoff, payoff of that effort, it's huge. It's something that you can. I actually, while I was doing it, I knew the impact it will have on my life. But sometimes you can't at the moment. That's fine. But yeah, sometimes you do have to go that extra mile and get things done. And this is for me that this is that thing for me. Like going to this university and doing that extensive 3 year program gave me all the basis for everything that I've done so far. It was a very thorough, very good specialty program. Then after that, I started practicing. I had a private practice with my father, and he was my inspiration into becoming a dentist. Him and I, we worked together. Well, since I was basically in high school, I was already helping him with cephalometrics analysis and even doing some lab work for him. It was really great. I really enjoyed it. Every summer, I will spend the summer at his office and hanging out, and that was my shadow mentor, basically. So it was he made me fall in love with our specialty and the dental profession in general. That's where I saw how the day went by and what he did and all that. I really loved it. I really loved the balance, and we'll talk more about this in later on in the lecture. Yeah, I also, while I was practicing, I was also given the opportunity to lecture at the ortho programs in Venezuela, which are just two. The one I did in Carabobo and at Caracas at the Central University of Venezuela. So at those two, I helped out since 2012 to 2018. And that was a wonderful experience teaching. It was part time, obviously, it wasn't full time because I was working, but it was very enjoyable. I did it once a month at the Carabobo University and every week at the Central University. And I had many opportunities to go internationally to lecture, which was very enjoyable. I went many times to Brazil. I forgot to mention Mexico on this list, and actually Mexico is one of the countries that I've gone the most. Colombia, Costa Rica, Italy, I went a couple times, and the US, it was just one time. Really wonderful meeting with one of my biggest influences in my career. So all those experiences were incredibly enriching. When you go and lecture, you're one of the people in that room that are gonna get the most information. It's I don't know how it happens, but it's wonderful. You go out there, you do your thing, you show what you wanted to show, and at the end of the lectures, usually you have so much interactions with everyone. People will come close and talk to you, and it's just amazing. It's just amazing the way you get approached and you can talk to a lot of people, and they show you their stuff as well and how they do their stuff, and it's always wonderful. It's always such a huge learning experience. And when you get invited to the same meeting where speakers that you admire are going to be there, that's also incredible because you get to interact with them at a different level, and it's just wonderful. Those All those experiences were just fantastic. And well, about the pictures, the one on the bottom is the Central University of Venezuela. The one, the second to last is the office building where we had the office, dental office, and the photos on the bottom are me and my dad at the office, and then me with a patient there. I really miss my office over there, as you can imagine, working already almost a decade over there, already seeing patients, have built a practice over there. It was very heartbreaking to lose that and to leave that behind you. And one of the main reasons for me to leave the country was basically the political instability in the country that leads to so many other nuances and problems in your personal life that are very cumbersome. And so over there, the biggest issues were in personal safety, and like it was turning very, very dangerous in your day to day life. It was just crazy. And in terms of practicing, inflation was a huge issue. Like inflation was through the roof, and crazy numbers. Like statistically, I think it's the number one country in the world for quite a few years with the highest inflation rate. So every day, everything changes. The pricing of your dental equipments, your materials, the pricing that you give to patients as well. It was so hard to manage. It takes so much of your energy, and I kind of waited and waited for this to improve, and it's just taking forever. Those pictures were taken by me on manifestations over there against the government. I went to almost all of them. I really tried. And yeah, it's heartbreaking to leave your country behind with all those issues. You want to be nationalist, you want to be passionate about your country and fight for it. But at some point, depending on the situation, obviously, it's something that it's beyond you. You know, it's really hard. And Venezuela is one of those situations where the government it's intertwined with so much corruption from terrorist groups, from drug cartels, and international forces that it's really hard for us as just citizens to really get a grasp of what's going on over there. So it's also that was one of the things like you don't know exactly where you're fighting, you know. So that was also very frustrating. You were at those rallies, like I'm showing you here in the pictures, and you don't know exactly who you're fighting, you know. And then every time a bunch of militaries will come over and start shooting people, and it was just a massacre every time. It was just awful. You go home just heartbroken, and it was over and over this situation. It was just unbearable for me. And yeah, 2018, my wife and I took the hard decision of just leaving the country, and we left all of that behind us, and we're still very passionate about our country and what's going on there, and trying to make a positive impact of what happens next. And but yeah, but for now, for our personal safety of the growth of our family, our kids, we just think this was the best decision in the meantime, and to allow for that to happen. And one of the questions that I wanted to answer today was what made me a competitive applicant. And being a faculty, these pictures, what I wanted to illustrate here is just a little bit about my experience of being a faculty. And when I think when I present my resume, that's something that shows. And it shows in two ways as my experience and also on my research. The research that I've done, most of it is because I was a faculty, so I got to participate on the students' um, I forgot the name, but well, basically the article and the research work they have to do before they graduate, and that was very always very rewarding, and we always learn so much from that. And yeah, on the interviews and all that, I talked about it in because it was really a life changing experience for me to be able to go there every week. At my office over there, I used to see like 25 to 30 patients per day, which was a good number for the way we worked in Venezuela. Orthodontists over there, we don't hand our work as much as here in the U.S. Here in the U.S., orthodontists rely more on the assistants, and they get to see bigger numbers of patients every day. And so I used to see over there like 25, 30 per day. And at the school, I will hang out with like 15, 16 students at a time, and they all saw like 3 or 4 patients in a morning. So I got to see all of those patients. It was really a lot of work and a lot of learning, So that was really remarkable. And so that was one of the things. And there are many things that can be appealing to the schools. They want diversity as well. Okay, so this international programs is a great opportunity for them to have that diversity on their schools. So if you're seeing us from abroad, the US, that's a big thing. Okay, that's a huge thing. They want people from everywhere, and yeah, when you present yourself there and they see that you're a valid and a good candidate, they want you there. If you're from a country that they don't have as many participants on the program, they're going to want you even more. So yeah, the diversity comes to play here. Is part of their algorithm to accept people. One more thing is experience in general. Okay, not only as a faculty, not only as a lecturer. Any experience in the field is going to help you grow. It's going to help you learn. So do think about your resume. Do think about your possibilities and being competitive as an applicant. But the first thing has to be your learning experience. Okay, so go into every possible situation, trying to get the most out of it for your learning, and that's gonna eventually show on your resume. Okay, so work hard on getting yourself into trouble, getting yourself out of your comfort zone, and learn out of all of those experiences. And believe me that that's gonna show on your resume. People are gonna notice. And about choosing specialties, so specialties, each one of them are going to bring their own package of knowledge that is going to help you in the future, right? So about orthodontics, it's going to help a lot with anatomy. We see a lot of anatomy, and they really hammer down about growth, development, embryology. So all of the things about developing the craniofacial complex, it's gonna be huge. That's really one of the bases of being an orthodontist. So we see a lot of that. And that really comes in handy if you, like myself, like I'm in this situation where I'm studying again and everything, all the courses. Now I'm seeing, for example, pedo. I get to study pediatric dentistry again. And when I see growth and development, when I see embryology, that's something that I'm already very familiarized with. And that really helps me there. Occlusion is a huge thing as well, obviously. So, as an orthodontist, we have a slightly different view of occlusion. We see it as a little more dynamic than a prosthodontist. At the dental schools, usually the predominant view of occlusion is more towards prosthodontics. So we do collide a little bit there, but it's not huge, especially nowadays. It's evolved to a point where we are meeting each other very closely now, and I think what we're studying everywhere in the world is very, very similar, and there's not a huge gap anymore. Just little things here and there about point of views, especially because of the way we treat the patient. But from a diagnostic point of view, it's more and more similar. About bone metabolism, and what I mean by that is the way the tooth move around the bone and the way it resorbs and the way it creates new bone and all that related to orthodontic movement. We see tons of that. And that really helps when we are talking about bone remodeling, when you are talking about implants and the way they integrate. And it really helps you understand other subjects about healing after a perio treatment, for example. So all of that comes in handy. Biomechanics is huge, and that's something that helps you understand the way other dental materials work and how they perform in the mouth. Aesthetics is great as well. When you analyze aesthetics from an orthodontic point of view, it's the same as from a surgeon point of view or from a cosmetic dentist point of view. So that knowledge is something that you're going to carry with you. It's going to help you with tons of cases, tons of clinical situations. And then there's, I will say, like skills that you gain as an orthodontist that are helpful everywhere. Like clinical photography, we really take photos every time, every appointment with interesting cases. We do initials, finals, and we do all of the photos. So we really do very thorough photographs, and that really helps you when you're doing something else. We research at many specialty programs. You're going to have to research a little more than you do on the dental program. So that's something that really comes in handy to be more critical about the studies and the articles you read further in your career. And that really helps you all the way. Every time you get a magazine, an article, a journal, you're going to look at it from a different perspective because you know what it takes to be a good article and having a proper methodology and all that. And statistics is also part of that. And you see some of those tools to create a good research, and those are always going to come in handy. So every specialty, if you're an international student and you have a specialty program, that's going to help you a ton. That relates to the previous subject about being more um, competitive as an applicant. If you have a specialty, that's really going to help you because they know in those areas you're going to be stronger. You're going to have that background that's going to support you. And about what a typical day is like as a dentist, I will say it's extremely rewarding. First of all, it's being a dentist is fantastic. It's you do have a lot on your shoulders in terms of responsibilities and the how can I put this into words, the I'll say the responsibility of what you're doing with your hands, with your skills, and the decision making that you're having, the impact that has on someone, on that patient's health, that's huge, and it really weighs on your shoulders, and that's something that you feel. It gets better over time, and I had that experience of practicing in Venezuela for many years, and I can tell you that it does get better over time because you get more and more confident about your decisions, and yeah, you always have to be very critical and check yourself often because you don't want to become you don't want to become it you don't want the office to become like a cooking recipe. Okay, like I see this, then my diagnostic is that, and my treatment is this. I know we want protocols, I know we're trying to create standards and all that, but every patient is different, and you always have to keep your eyes open for those differences and adjust your protocols and adjust your diagnosis as necessary. But you do become more confident and more relaxed while you're working, and that responsibility is still on your shoulders, but it doesn't weigh as much over time. And the typical problems that we encounter with patients are pain. Obviously, it's something that you have to deal with basically every day and on all specialties. Function, and what I mean by this is that the patient is going to have one of their functions limited by the pain or the problem they're having. So they might not be able to speak well or chew well or taste food or something. Something's gonna be going on, and that's also something that you're gonna have to think about and address every day. Anesthetics, obviously, as a less important of a problem, but it's also something on your day to day as a dentist, someone that will come in and their chief complaint is something aesthetics. Like, I have a wedding and I'm missing a tooth, I have a cracked teeth and I want to fill. And so that's going to be huge as well. As an orthodontist, obviously, that's a little more profound, a little more enhanced every day. Like, you do see a lot of that every day. But as a general dentist, is something that you might not encounter every day. The toughest part about proposing a treatment plan to a patient is informing the patient all the options that it has from a respectful and objective way. What I mean by this is that sometimes, especially for international dentists, some of us were trained in a very paternalistic way. So my previous training was, I know more about this subject, I'm the expert on this subject, so let me tell you, patient, that this option is better for you. So here in the US, the training now it's different, and the patient autonomy is huge, and it's something that has to come first every time. So the way you present treatment options, you really have to try to draw all your personal opinions about it first before you present to the patient. And often the patient is going to ask you, like, okay, you're the expert on this, what's your opinion about it? And you still have to be very careful. You Once a patient asks, you can throw some opinions in there, but you have to be really careful about how you do it. So yeah, I think that's one of the struggles there, because sometimes you just want to tell the patient, like, you should really do this. And that's it. And so yeah, it's hard to keep a balance there. And managing expectations is always hard. That's something that has to be done from the get go. From the moment you say hi to the patient, you have to always think about what this patient is thinking about their needs. Okay, and you have to constantly be asking about it, and keeping that chief complaint in mind, keeping the result the patient wants in mind. And if it's not a good match, just be very open about it. Okay, like, I don't think we're a good match. I don't think your expectations and mines are a good match here. I don't think with my treatment you're gonna be satisfied, all this and all that, and that's something that could really, really save you some problems down the road. Cost of treatment is huge everywhere in the world. Dental treatment is very expensive, and it's a huge concern. And it becomes a really like a public health kind of issue, and really huge problem for the government, for the state, for everyone really, because it's really not affordable anymore. So it's really, I think cost is really important, and we're trying to sell, or we're trying to propose these treatments to patients, and sometimes they can't afford it. And that's really frustrating for both the patients and yourself. And that's something you have to deal very frequently with. Timing, it's an issue as well. Sometimes treatments are not easy. Patients are expecting for you to just wait for one and just have everything fixed, and it doesn't work like that. Some treatments are long term. If you're trying to do a denture, for example, and the patient had teeth already, you have to extract those teeth and wait a few months for healing, and then do the dentures some months down the road. and some patients really struggle with this, and they neglect their mouth for years, and they then expect you to fix everything in just a few appointments. So timing is an issue, a constant issue as well for dentists that struggle with the patient. Like, okay, I'm going to have to see you a couple times for this, and how does your schedule work? And yeah, trying to make that work really, it's really cumbersome sometimes. And yeah, I wanted to also bring you some cases of my previous experience back in Venezuela as an orthodontist. I used to do a lot of orthodontics and or orthodontics to trying to compensate surgical issues. So we had big malocclusions like this one with anterior crossbites, class 3 malocclusion. So you have the lower teeth wrapping around the top teeth, and that usually comes with facial concavity as well. So there's some facial aesthetic issues as well. And the patient, for some reason, sometimes they don't want to go through surgery. Sometimes it's too expensive. Sometimes they have an underlying medical issue that prevents them from going through surgery, or from going through the post-op recommendations of eating soft foods and that kind of stuff. And sometimes they can't do that. So yeah, there's a lot of reasons, and once I started doing this, more patients were referred to me to do it, and I found out about many other reasons that I never even thought about. And yeah, this was very interesting. It was very helpful. It made us kind of practice and even invent some movements and little tips and techniques with orthodontics, with wires and stuff, that really help other patients entirely. There are concepts about how we fix this that we started to apply to even techniques like Invisalign, and really help us plan treatments faster and easier, because we were doing some of this same diagnosis and same movements, but with different tools. So this case, it took us like 2 3 years, and so it was a long treatment, but we were able to eliminate enough interferences on the posterior teeth that will allow the patient to reposition his mandible. And he was able, I'm going to go back here, and you can see the mandibular deviation towards the right as well. So that mandibular deviation is a lot better at the end. It's not perfect, as you can see, but it's a lot better. And the patient was happy, and I still have contact with this patient. He's a dental technician, so we're friends, and he's still very stable. He's wearing his retainer, and his bite is just stable. And after all these years, so very cool type of treatment. As you can see on the wires, we do some bends on them, and that's a special type of wire of a special alloy that's very bendable and very flexible, but at the same time, it allows you to do those activations. This is a second case, another patient, very young, 22. But at 22, she was still doing thumb sucking as a habit, and she had periodontitis as well. So um, the case as a whole was very complex. You had a really harmful habit, as it's thumb sucking. But you also have the periodontitis, so you don't want to move any teeth before you get that worked out, because otherwise you're going to lose a lot of bone. There was some bone loss already. You had that posterior crossbite as well. So very complex case. We worked with a periodontist first for a few months, and she was more stable. And that's when we started expanding on the maxilla. We used an expander on the palate for a few months, but it was hard for her to bear. We moved on to this thick wire that you can see on top of the regular wire on the bottom. And that wire is expanding the maxilla as well. That was very helpful. And at the same time, we have the same technique that we used with the prior case, and rubber band wear. It's very important. And what we're doing with this anterior open bite is basically And instead of just pushing the anterior teeth to be close together, we're actually intruding and pushing into the bone the posterior teeth. So you have no contact on the back, so there's no other way but to close that open line on the front. And as you can see, there's some over treatment on the back, and those posterior teeth are not even touching, which is what we wanted in this case. So very interesting, and we were doing a lot of this, and I used to love this quite a bit. This took us like 2 years. It's not crazy long or anything like that. As you can see, the gums were very stable at the end. And then there's, this is not the same case. I just kind of like bunched up a few interesting bits over here about micro implants, and we also call them TATs, temporary anchorage devices, which are just tiny implants extruded into the bone to help us do some movements that we weren't able before. So this patient was ready to go for a bridge on the top, and this premolar was just in the way. So they were gonna just chop it off, and I was involved in the planning. I was like, hey, if you just give me a couple months, I can fix that. And the patient was interested, but he didn't want full orthodontics with Invisalign or braces, nothing like that. And he really didn't need it. Like everything else was pretty much okay. As you can see on the bottom arch, it's pretty much aligned. The top arch was pretty good as well. So we just did this. Tad, one bracket, one tad, and just a piece of wire with a good mechanics there, and just intruded that in just a few weeks. It was just crazy. And then we have this case over here. Also, the patient was trying to get an implant and a crown back here, and she also didn't want full braces, a full treatment to fix something like that. She also didn't want the top molar to be chopped off. So two implants, one on the buccal, one on the lingual, and then like a little hammock with this a rubber band. We went through there with a button, also a little bracket on the occlusal face here, and that worked great. We just push it into the bone. I mean, at the end, you can see that it's aligned with the other teeth vertically, and they have more space now to put an implant and a crown there. So those are just interesting new things that we can do in orthodontics now that sometimes we don't think about them. Well, they're there and they just make your day more interesting, and they're just fun to do, and you really help the patient and help your colleagues as well. So you become part of this group of specialists that are just doing cool stuff, and this is really cool for the prosthodontists involved to be able to do something different, to what they do on their day-to-day things. And what is harder about being a dentist is we're trained to be perfectionists. Like we're trained to see a half of a millimeter and distinguish that from a full millimeter. So we're trained to do that kind of stuff, and it's just hard. It's just really hard to get it every time. So when you don't get it, you feel frustrated, you feel tired, you feel just bad overall. You have a bad day, and sometimes when you put things into perspective, it's just 1 millimeter. And yeah, and sometimes that millimeter can, if you're on the edge, that millimeter can really make a difference on that case, but most of the times it really doesn't. And you're just killing and beating yourself over nothing. And being leaders, sometimes this really weighs on your shoulders, and you're just not born for that. And I'm a good example of that. Like I've been in the situation of being the lead dentist at the office and being a faculty, so you're in charge of that clinic that day, and it's really not my thing. Like it's really, I rather just kind of like follow, or sort of speak. Like I'm not a leader in nature, but you kind of just have to step up to that position when you're a dentist. It's just something you have to do. At the office, people, the staff, the patients are going to look up to you for decision making, for um, for everything. Even if you're thinking about an emergency at the office that has nothing to do with patient care, it's just something that's going on, people are going to look for you for advice to at that point, in those seconds of decision making. They're going to look up to you and say, and just kind of ask you with their eyes, like, what do we do? Do we run? Do we call someone? Like, so at the office, you're the leader there, whether you want that or not. So that's something that could be great for someone that really was born for that and they're natural leaders. But that's something that is really sometimes a struggle for some of us that are not. And staying up to date, that's something that I particularly don't struggle with because I'm very passionate about studying and I do like to keep myself up to date. I get the journals and I read through them, and it's really just fun for me. But yeah, that's another thing that is not for everyone. Some people just want to go to school, graduate, and just go practice. You can't. You just can't. You have to pick up a journal at least once a week and just have a good read and be up to date and read the emails about the ADA and see if something changed, any specifics about an antibiotic recommendation or a local anesthetic recommendation. And you do have to really stay up to date and attend continuing education courses and all that. Hand-eye coordination and skills, that's something that some people really struggle with as well. And you practice so much in dentistry that we all become really good at it. But some really struggle with this and they feel they're not as good as others and they see this as a barrier throughout their careers. And yeah, it's a struggle. You feel like you're trying to keep up with other dentists or your classmates or whatever, and it's a struggle. Obviously, not everyone's going to have their same skills, and that's okay as long as you hit the mark and you're doing the work and reaching the standard of care for the work that you're doing. But yeah, for some that reaching that standard is not enough. They want to do better in their hand-eye coordination or skills are not there, and that's something that yeah can be a barrier for some. And having a balanced life, it is a very busy career, and like I said, you have to be up to date. You have to go to courses. You have to. So yeah, you it's always going to be a struggle to balance your personal life with this profession, but it's not impossible, and it's so much better than other professions as well. Like some people are just not sure if they want to be a physician or a dentist, and that's one of the things that is slightly different. And dentists get to have more of a balanced life than physicians, for example. Being a physician is tougher in that way. So you go through being a dentist and you kind of regret it. You like the medical stuff. You still have the chance of becoming an oral surgeon. And oral surgeons is one of those specialties that are really going to be more time consuming for you, not just because it's a longer specialty to study, but once you're practicing, it's really easier. And yeah, I think those are the hardest thing about being a dentist. And so yeah, if you have any questions, and this is my Instagram accounts. The one on the top is my personal one, and the one on the bottom is more professional with my father as well in there, and it's more Spanish. It's more towards Spanish, but we also sometimes get some stuff in English. We're not lazy sometimes, and we do translate. And yeah, you can reach me at any of those, and it was very nice joining you. And Juan, thank you for having me.
Thank you so much, Dr. Garcia. And we do have several questions collected from the Instagram. So I think you mentioned it a little bit, but would you explain on how is dentistry practiced differently between Venezuela and the U.S.?
Yeah, for what I can tell so far, yeah, we do in Venezuela. We don't rely on assistance as much, and they sometimes get the patient ready for braces for you, and they can sometimes do bands on your patients and do part of their control with removing the arches and stuff so that the patient can go and brush and that kind of stuff. But here, they take that a little further and they can even place braces, and the orthodontist just go and just look at the position and kind of fixes here and there if he doesn't agree with the position, and they light them up, and that's it. Or wires, they don't just take them out, they can also put them back in. They can do retraction arches and do bends on the wire and activate them. And especially if you're bending wires and you're doing loops and stuff back in Venezuela, especially on those times, the orthodontics will do those 100 times. Like it will do those every time, and make sure the activation is exactly what you wanted and stuff. So in that sense, it's more hands-on, a little more tiring on the orthodontist. And yeah, for some reason, I think it's a matter of training of the assistants. And I'm not sure exactly all the factors that are there, but it's definitely different in that sense.
Mhm. Thank you. And I think you also have explained a little bit on about this why you came to the U.S. But aside from the political problems, would there something you see in the U.S. that makes you want to go to the U.S. instead of other countries?
Yes, I was actually I'm certified to work in Colombia and Mexico. So yeah, I did have a choice, and I just find that the situation in Venezuela was so frustrating. Like your success wasn't entirely in your hands, you know, and I felt that I was doing everything I could. You can always do better. You can obviously always push yourself harder and reinvent yourself. And but I felt at that point that I was kind of doing everything I could. I felt actually tired, and I felt like I was really pushing myself, and I was kind of stuck. So in the U.S., I I feel like you don't have a roof on your head. Like you can just go and do your thing, and there's always something further that you can achieve. If you push yourself harder, you get there, and there's always something else that you can look forward in the future. So, and I feel like there's no limit here, and the situation politically and economically is there for you to attempt it if you want to. So that was my that's how I felt at the moment, and I felt like it was a huge opportunity. And I can't say I'm right yet because I'm early in school. But for what I can see so far, and I think definitely that's the case. I think the U.S. have many opportunities. I really think it's a country of opportunities, even with all the situations that have happened in recent years. I think this is still the country where anything can happen, you know, and you can just really strive for what you really want.
Yeah, I'm sorry to hear about the your story about the political problem in Venezuela because I do have a lot of friends from Venezuela and they're so nice. They're really nice people. And yeah, it's true about the American dream, right? You go there, you work hard, and you're not limited with other stuff. You're able to push yourself further, and that's why people go there. Can you?
That's how I feel. Thank you.
Yeah. Can you share about your interview and bench test experience?
Yes, I did that in 2019. So it was pre-COVID. So I did it in person. It was very cool, but also very nerve-wracking as well. And so it was 2018. I was invited, I think in May or June. I can't remember right now. And it was one day thing. It was just one full day at the school, and you got interview, you got meetings with students, so you can ask them questions. You had the bench test, which was two parts. We did class two on a maxillary first molar. We did a crown prep on a mandibular first molar. And then we went to the waxing exercise, and we waxed up premolar, if I remember correctly. And yeah, you had also like a lecture about finances and how that works here in the US and the type of loans that you could get to pay for your schooling and all that, and scholarships. So that was very interesting as well. And yeah, I think a meeting about immigration as well for us as international dentists. So something to think about, the type of visas that you could get and all that. And yeah, it was a full day, very tiring, very nerve wracking. The interview itself was very nice. You had two faculties and two students. Usually, that was the case. It could be one and three or something like that, but you often have faculties and students. And and yeah, they ask you about your resume. They ask you to talk about yourself. I think you do have to prepare for that. You want to really be yourself, but you have to think about that. You can't be yourself if you're super nervous, and you are going to be super nervous. So you have to practice so it comes. You can really leave the nerves alone. They're not going to go anywhere. They're going to stay there. Believe me, for the entire interview, they're going to be there bothering you. But you can also push through and just say what you wanted to say. So yeah, practice a lot, and the typical questions, nothing crazy. Just practice just talking about yourself and decision making and all that in your life. And they also show you one or two cases, I think, on X-rays. They showed me PAs, periapicals, I think, and they asked me about it. Like, what do you see here? And you just have to describe it. And yeah, that was it. It was very nice. You get to ask questions as well. So it's a great opportunity to learn more about the school or the faculties or the students' perspectives as well. So that was nice of them, and they do that here.
Hmm. And if I'm not wrong, I think you only applied to one school, right? And then you got in.
Yes, it was like that because of the timing where Colorado is. I got here in the US in May 2018. I studied for the board test and all that, and by November I was set and I was able to apply. It was already open since like October or the end of September, and I was able to apply. Yeah, like I think it was October when I applied. And yeah, at the beginning of the year, I took the part two board test. But back then it was the two parts.
Mm-hmm.
I took the part two and added that to my application.
Mm-hmm.
And you can even retake the TOEFL test. Once you apply, you can even retake it and then update your grade. If you got a bigger score, you can send that to them and you'll get that bumped up. And yeah, I immediately got an answer. And like in May, the rest of the programs open, and I had already gotten the invitation for the interview. And I waited. I went through the interview, and in July they let me know I was in. So yeah, I just left the rest of the application alone. And
That's
just
amazing. That's
saved
amazing.
that money because it costs a lot of money to apply for
Yeah.
this school. So,
Uh-huh.
yeah.
And because I know a lot of people want to go to Colorado because it's such a good program there. And well, it's just amazing how you got in the first cycle. That's just insane.
Thank you. Yeah, it was very lucky, very fortunate,
Mhm.
and yeah, it's a great program and very wide, very spread on the knowledge that you get, and yeah, I highly recommend it. It's a great city to be in here in Denver. It's a great city to just come and visit. So it's great to get to live here, at least for the few years that you're studying here. It's very nice.
Did you take any advanced course in the state?
No, I did had some mentorship, and one of my classmates from my specialty program, she did all of this a bit first than I did. So by the time I came here to the US, she was already accepted to a program at BU. So she was like a year or two ahead of me, and she was my mentor in all this. Like, do this first and do this now. So I didn't feel the need to do it, and I really trust her, and she really guided me through the process. And yeah, I thought about it many times, but I really felt mentored, and I just went through all the recommendations that she gave me. I did practice. I did practice quite a bit. I had access to a dental office for a few months while I was applying, and I went in that office and just drilled away
Mm-hmm.
and practiced on many plastic teeth. Here's some because I'm practicing
Oh.
for my board exams. I have many here. That was the case back then as well.
Uh-huh. And then you also mentioned that you didn't use loops,
Yeah,
and that's oh man, because
it was hard. Yeah, I wasn't used to them, and I felt that I didn't have enough time to get used to
uh-huh.
them before the bench test. That they were just gonna be a barrier for me. And yeah, I just went ahead and do it without loops, and it was a struggle.
Uh-huh. That's
And now that I'm
insane.
used to them, it's crazy. Yeah, it's now that I use them, I don't even know how I did it.
Because the bench test in Colorado, they are really strict about the ergonomic. So that's why like I was so shocked that you did it without loop, and man.
I think I
would
bended my neck a couple times
uh-huh.
just to get on the rough spots.
Uh-huh. You gotta make sure the staff wasn't watching you.
Yeah, yeah, you just have to look over your shoulder and
That's
go in and,
funny.
and see what you're doing. Yeah, it's definitely tough, and I don't recommend it. Yeah, if
Uh-huh.
you can get used to your loops beforehand, much better.
Uh-huh. Well, would you say, with an estimation, how many people went to the bench test and how many that you still meet after you got into the program?
Um, the year I applied, it was for 1,600 people that applied
Mm-hmm.
to the international program for those 40 spots. And we were called for interview, 600 of us. It was
Wow.
3 days
Mm-hmm.
of 200 people.
Mm-hmm.
And yeah, you don't see many, to be
Wow.
honest. Like from that day that you go, the ones that I met was basically the ones I went into a little room to talk with students, with current students. And those were the ones that I got to see more, interact more for a longer time. And I don't remember any of them getting into the program. And I do remember, yeah, seeing one or two of them that are currently my classmates, and yeah,
Mm-hmm.
I didn't got into the program right away because of my visa. Once I got approved, I was deferred for a full year. And one of those people that I met that day, it's actually my classmate now because she also deferred. And for personal issues, she had to postpone her start date. And yeah, she ended up with me. And another Venezuelan as well. She was applying that year, and I heard about her, but I didn't got to see her that day. And then I met her once I was in the program. She was my senior. She already graduated last
Ah.
December. I would have graduated with her last December.
Mm-hmm.
But yeah, you don't. Not many get there. It's 6% for the international program here.
Wow.
I know it's pretty low, but it's actually twice as the regular dental students,
Mm-hmm.
and is actually twice of many of the programs here in the U.S. So it actually has a higher percentage rate than others.
Mm-hmm.
At BU, they have 80 spots, but the amount of people that apply at BU, it's insane.
Mm-hmm.
It's much more than here.
Got it. And let me ask you some like last few questions before I
Yeah,
let you go because I know it's been taking a lot of your time.
no,
So
you're fine.
you mentioned that you had recommendations from two highly respected orthodontists. Will you kind of give us some advice on how to approach the dentist and without being really aggressive or annoying?
Yeah, I was gonna talk about that. Yeah, about the lecturing stuff. I think applying for lectures at meetings and stuff, it's one of the best ways of meeting other lecturers as well. On that roster of lecturers that are gonna be there that day lecturing with you, there's gonna be most likely at least one that you really admire and you wanted to meet him or something. And that's your best, one of your best shots because you're gonna be on a better position that day because you're presenting yourself as well, and that's not too hard. Like in many countries, applying for a lecture here and there, meetings and annual sessions and stuff, it's not that hard to get approved. So try to look through your research and look through the stuff you already done or things that you want to do and get it done so you can have that material there ready and try to do that. And I think that's one of the best ways to approach them. Also, just approach them as a participant at a lecture or a program that they're giving. I think that's a great way. And yeah, just be open about it that you're trying to do this and that, and you're trying to get into this or that program. And yeah, if you can build up a relationship first in terms of interchanging information and cases or articles, like what do you think about this article and this and that? I think that scientific way and professional way of connecting
Hmm.
really will give you space for asking such a question. And then shadowing, physically shadowing, like if you go there to their office and just hang there for months, you go there like let's say once a week for a few months to a specific office and you're there, you're learning, you're picking up tips and tricks, and that's going to be super helpful for you overall. But it will also get you that opportunity to in the
Hmm.
future ask them for recommendation letters like this ones. And yeah, you can do this at offices, but you can also do this at departments at schools. You can also ask them about this shadowing opportunities. With COVID, I know it's extremely hard,
Hmm.
but hopefully soon those opportunities will be open again.
I really like your advice. It's nice.
For sure.
Let me do last three questions. I'm so sorry for
No, no,
taking a lot of the time. So, if time rewinds, what advice will you give to your younger self?
no. I will probably tell him, tell myself, and yeah, just to keep up, and that will it will pay off
Mhm.
eventually. Like all the hard studying all the nights without sleeping, reading and studying. And maybe yeah, not to worry, don't
Mhm.
worry too much. It will pay off.
Mhm.
And yeah, I don't professionally, honestly, I don't have many regrets. I'm very happy with the career that I have built for myself, and very thankful for all the opportunities I have been given. And yeah, I think I have taken them to the fullest. And yeah, that's why I think, and it was one of my advices that just grab every opportunity you have, and there's going to be learning on that. Whether it's clinical or research, just be
Mhm.
open minded. Like for me, it's for example, research wasn't my thing at all when I was in dental school. And yeah, I kind of like push myself into that. Just get out of your comfort zone. That's something that is always going to make you grow. And I did it, and it did. Yeah, it did make me grow. It made me understand other people's research a lot better. It made me bond with people, and like you mentioned before, that's so important for the recommendation letters. And it made me bond with other professionals that I wouldn't have anything in common prior to that.
Mhm.
So yeah, just I will tell myself just to push through,
Yeah.
just keep it up.
Mhm. And prior, you were talking about diversity. Will you expand on that? Do you mean diversity like from different countries, or do you mean diversity in other ways? Because it's a very vague term, like when you talk about being a diverse
Yeah,
applicant?
I do mean it in a broad way. Like it's yeah, they're interested in diversity in every way. They want people from every background. They want older guys like myself in the programs, but they want also the recently graduated that has no experience at all. He just graduated fresh from school, and so they want it all. They really
Mhm.
want them all, and you can see it on every batch. There's everyone there, and in terms of race, in terms of color, in terms of everything, they really want to be diverse. That's what brings more learning and more a better experience for
Mhm.
everyone. When you have that diverse group, um, culturally, we all grow.
Mhm.
So that's something they know because they tried before, and they really strive for that. And they're really doing the best they can in trying to have that diversity in every school.
Mhm.
So yeah, it's an advantage in some way if you're an international student and you're from an underrepresented country here in the US. That's a huge advantage for you. If you are from a country that it's more represented here in the US, then it's going to be a little more difficult, and you have to know that. So you have to be a little more competitive, and you have to see what can differentiate you from your from the applicants from your home country. So you have to really set aside from that. And so yeah, it's something to be mindful of, but for most people, it's something that is actually going to help them.
Mhm. And for the fresh graduate in your class, would you say what was something that stand out on their resume? Will you give us some light into it?
Or excuse me, for my seniors.
No, I mean the student who are fresh graduate in your class. What was something? What about them? Like, what make them stand out as without experience?
Oh, okay. Oh, you mean for the classmates that were applicants that were freshly graduated?
Yeah, yeah.
Okay, I think they're great students. I think they probably had really good grades, and they were active um, in the dental scene somehow. They had probably like student positions in their own home countries,
Mhm.
or they participated in event planning or event organizations. And so yeah, they were very active in the profession.
Mm.
And so I see them as very good leaders.
Mhm.
So I think those are the one of the features that I see on them, on my younger classmates.
Mhm.
And they're really good leaders, and they're really good students. And yeah, I think those are their qualities. They're really open to really go at it and study a lot. As an older student, you kind of have to be that way as well. You can't be a know-it-all type of person.
Mhm.
You have to really show them that you're open to new knowledge, and you are really a person that really wants to be a lifelong learner, and you're not thinking that you haven't seen it all, done it all type
Mhm.
of fellow. So on the older fellas, older classmates in my batch, that's the one thing we have in common. Like we're
Mhm.
open to learning new stuff, and yeah. So as a freshly graduated, you have to be able to, even though you have a fewer experience, you have to be able to show that you really want to learn, you want more info, you want more experience, and you're very eager
Mhm.
for that.
Got it. And then one last question is, what are some of your advices that you would give to the international trained dentists who are applying this cycle?
Well, I think this for this specific cycle, COVID's still a major obstacle to enriching your resume. So yeah, work on your possible recommendation letters. And so work on that. Try to make a list of the possible people that you're going to ask them that question about the letter, and you can start reaching out to some of them if you feel the timing is right. And you can also do some CE online. It's one of those moments where that really exploded, and there's a lot of stuff to do online. So really push yourself into signing up for a lot of seminars. If you really want to emphasize something on your resume, that's a good way to do it. So if you want to show that you're good at something and you know about something specifically, then show it on your resume as a lot of prep on your CE courses about that subject. So that's something that you can do. So it doesn't have to be all over the place, like doing whatever CE. You can really focus it on the subjects that you really want to shine on your resume. And if you have an opportunity to come to the US and do some work here, and that's very advisable. If you can go to an office here, things over here are pretty much open now. So if you knock on doors, I will say that it's very likely for a door to open for you, so you can do some in-person shadowing, and that would be really good for your resume. If you can show a US experience on your resume that you were here and you saw how things were here at the dental office, I think that's something that's going to weigh on your resume quite a bit. Or if you get a work visa and you can even try for a job. There's a lot of openings here in the US right now because of COVID. So many people shifted works and stuff. So a lot of people are looking for assistants. So if you can be an assistant, well, many states you don't need anything to be an assistant. If you're an international trained dentist, you don't need anything at all, just a work permit. So yeah, you get a chance to do that, that'll be really awesome.
Thank you so much. I think that's all we have for today. And your presentation was very informative, and I'm sure our listeners got learned a lot from you today from today's session.
I'm very happy and honored you had me. I think what you're doing is really great, especially like I said on these times with COVID. I think it's great for people interested in pursuing this to have more info and know a little more about different backgrounds and different ways of practicing and stuff. And yeah, thank you for doing this. It's really nice.
Thank you. And guys, go follow Dr. Garcia. I'm sure he will be more than willing to answer your questions if you have any. Yeah. And thank you all.
Thank you so much.